Welcome back, dear viewers, and with our first guest, organizing a committee for the third Public Health Conference, Advancing Public Health through Collaboration and Partnership. The third Public Health Conference is a national scientific event organized under the Ministry of Health. The conference will be held over 2 days and focuses on strengthening public health systems through collaboration, integration, and of course, partnership. To know more about this kind of collaboration, please join me to welcome Dr. Mariam Mansouri, Head of the Public Health Department in Salwa Health Region. So, good morning, Dr. Mariam.
Good morning. Good morning.
So, it's to have you with us. Good morning, Kuwait, because we need more, let's say, more explanation, clarification about, let's say, the whole system. So to shoot with the first question, as you know, with the third Public Health Conference, and why it is important here in Kuwait, why it's now, especially in the, as I saw in the last 5 years, there is too much awareness and too much focus on the system, not in the way it works.
Okay, so thank you for the interview today. Thank you everyone for organizing and supporting Ministry of Health in its effort to control diseases. The third Public Health Conference is a platform where you bring different stakeholders. You bring healthcare professionals, policymakers, and experts who can improve health through multiple sectors. So why is it important at this time and place? Because we've seen after the COVID-19 pandemic, people are more aware of public health. Yes. And we know that it's not only the prevention and treating of diseases. There is a preparedness, surveillance, and how do we act, and the collaboration between multiple sectors. So this is the highlight.
It's not now, as we know, it's not that, let's say, the classic healthcare system, and everybody knows. Now let's say the Ministry of Health is trying to be more strategic and to have, let's say, futuristic vision, just to predict and to have let's say, an eye on what's happening internationally, because as you know, the people have now more awareness. So my second question, let's talk about the conference, still in the conference. It is titled Advancing Public Health through Collaboration and Partnership. What does it mean, collaboration and partnership? We know we have private and public. How does it work?
Brilliant. So basically within our conference, it is under the patronage of His Excellency Minister of Health, Dr. Ahmed Abdul Wahab Al-Awadi. Many thanks to him and for everybody participating in the conference. Basically, it's a collaboration between different entities, yes. Public Health Administration, Social Health Administration, the Infection Control and Prevention Administration, and Kuwait Center for Disease Control and Prevention. You bring all these experts from different backgrounds, or bring them together to make the control of disease and prevention and surveillance. So basically, when all these sectors collaborate with each other under the umbrella of Ministry of Health, we can catch diseases faster, we can make better decisions and improve policy decision, and we can bring recommendations that are evidence-based to improve healthcare system in general.
Well, that's interesting. But in the conference, is there any, like, let's say, top topics or main topics that need to be discussed and to shed light on? You know, every now and then we hear and read that there is a new pandemic happening. Let's say, I'm not going to name any countries because I don't want to raise concerns and red flags, but it happens that there is, in a certain country, there is a new kind of flu, there is a new kind of pandemic. So how does it work in the conference? What are the main topics?
First of all, thank you very much for not naming any country. This is the basic of this is 101 public health. So basically, what we're doing here in the conference, we have different themes. We would talk about surveillance, prevention of diseases, infectious diseases in general, and environmental and chemical safety. Also for public health emergencies. So it will be rich in all these topics with experts from Kuwait, from the region, and international partners that will bring the latest evidence-based recommendations.
That's interesting. And also, do you work with, let's say, other non-healthcare sectors, like, let's say, the aviation and airlines, just to include them and put them, let's say, in the loop, to tell them what are the latest strategies and what is our next, let's say, 5 years plan, and how do we monitor certain countries and, let's say, the passengers and visitors? We need to have, let's say, a disease control center inside the airport, especially the new airport. Do you work with them?
Thank you for this question. Yes, we have multiple stakeholders from different sectors. So within our program, we have the International Health Regulation, which was established in 2005, and
Yes.
it links the whole world through under the umbrella of the World Health Organization. Whenever there is a threat in one country, all countries in the world will be notified.
Yes.
We have them with us. Dr. Sodus Al-Gamandi will be giving that lecture. We also have the public health labs, of course, and other laboratories from other hospitals in Kuwait. We also have the environmental health will be participating with us. They are not under, they are not medical doctors. However, they are like very important partners
Involved
with us.
in the healthcare system.
Yes, yes.
So all
And
those.
for the readiness and preparedness for any
Yes.
diseases.
Okay. You said you invited a lot of stakeholders. Now let's talk about the conference. Who is, let's say, designated for, and who are, let's say, the target? We want you to come to the conference because you are, let's say, a main or an important player in the whole system. So who is it designated for?
So the conference is designated for any healthcare workers, public health professionals, of course, medics and non-medics. It is also directed and might be beneficial for environmental scientists, researchers, and anyone who's interested in policy makers and decision making.
Well, that's interesting. We hope that the Ministry of Education would be involved in that, because I remember when I was little, we had, let's say, medical centers inside every school.
We do.
Also a dental center.
Yeah.
We had our vaccines, we had, let's say, a regular checkup. I don't know if they have the same nowadays, but this is what we used to have, and we grew up, let's say, almost perfect.
Yeah.
So, Dr. Mariam, from the conference, from your own perspective and point of view, what do you think that you would come out from that? What is the final communique and beneficiary topics you would like to achieve?
Well, hopefully with this collaboration and this rich backgrounds of people involved in our conference, we hope that we can come with a recommendation, best practice to improve public health system and the whole healthcare system in Kuwait, inshallah.
Well, that's amazing. Now, let's talk about something important.
Okay.
تطمن.
All right.
Tell me more about تطمن. To be honest with you, I have, let's say, a vague and foggy idea about it, but I need you to explain it more for me. We have Salim, we have تطمن, we have a lot of programs and applications. Let's focus on تطمن.
Okay, so thank you for this question. تطمن is a voluntarily clinic that tests for HIV, syphilis, hepatitis B and hepatitis C, and it's done within the preventive medicine clinic. We just launched last month the fifth one, the newest one, in Salwa specialized center. So it's first floor when you come to the center.
That's amazing.
Yeah, it is weaved within preventive medicine, so people will not know where are you heading. So it's a complete privacy and.
So it's private, so you won't worry about, let's say, gossipy
Stigma,
eyes
yeah.
and other people, let's say, curiosity. But is there any other branches? Where is it also? We have one in Salwa, and we have also in other, let's say, main living areas, population.
So basically, it is the fifth clinic. There is one in public health administration, one in infectious diseases hospital, one in Farwaniya hospital, and one in Salwa specialized clinic.
Well, that's amazing. We hope we have one. I'm a Jahrawi girl, so we
Actually,
hope.
the infectious disease one is in Jahra.
Well,
so,
that's amazing. Okay, I need to know my area more. So that's amazing. We know we have, let's say, population expansion, and also we have residential areas expanding up north and south here in Kuwait. We need more centers. Not only the population is expanding, but we also recently, according to international reports from WHO, there are an increase in infectious diseases, especially among newlyweds. Do you think that the center will be associated with the Ministry of Justice in such matters? Because we know that when one of the inquiries of getting married is to have the certificate that you are free of diseases. Do you think it will be integrated together?
So basically, thank you for this question. And to answer that, welcome to our conference. Social Health are a partner with us, and they will talk about, we have different sections about the premarital tests.
Well, that's amazing.
Yeah.
So is it only for Kuwaitis or for residents in general, Kuwaitis and non-Kuwaitis?
For everyone who's getting married.
For everyone who's getting married. That's important. And now, let's talk about seasonal diseases.
Okay.
One of the camera ladies just sneezed. Yes. So let's talk about, now we have a rainy day. Let's talk about seasonal diseases. There is a flu in a certain country. We're not going to name that country. Do you think it will come to Kuwait?
Okay, so flu and influenza in general is seasonal. The question is not about if it will hit us.
Yeah.
It's when and how.
Exactly.
So basically, Ministry of Health is providing winter vaccination among the winter diseases campaign. The season in Kuwait is starts from end, or like let's say mid September till March. So we advise each and every person to get the annual influenza vaccine, and we have the PCV as well against pneumococcal diseases, which protect the lung and other organs once in a lifetime. But seasonal influenza is every year highly recommended.
Highly recommended to take the vaccinations. And also, let's talk about home remedies to stay warm, hot fluids, warm fluids, and to stay hydrated all time. And any, let's say, collapse or let's say extended period of a flu in the body. So Dr. Mariam, thank you very much for joining us in Good Morning Kuwait. You are a delight to have you.
Thank you very much.
I wish you all the best in the conference, and we hope that recommendations will be expanded among all the stakeholders.
Thank you very much. Thank you. Appreciate it.
Well, my dear viewers, that was Dr. Mariam Mansouri, Head of Public Health Department in Hawali Health Region. Now, we're going to take a break and then continue with Good Morning Kuwait segments.